Welcome to the first COSRH video on intrauterine contraception, or IUC, removal. Before beginning the procedure to remove an IUC, it is important to offer women the appropriate counseling. Women may have a range of reasons to want an IUC removed. They may want to get pregnant. They may no longer need contraception because they have reached the menopause, their partner has had a vasectomy, or they have changed personal circumstances. Alternatively, they may not be happy with this method and want to switch to another.
For removals for pregnancy, do brief preconception counseling, comprising advising the woman to stop smoking and to optimize weight. If the woman has a long-term health condition or is on medication, she should discuss her plans with their healthcare provider. Everyone should be advised to start taking a folic acid supplement, ideally a few months before conception. If her BMI is greater than 30 or she has diabetes or epilepsy, she will need 5 milligrams daily, which is only available on prescription. Everyone else can buy 400 micrograms pregnancy vitamins over the counter from the pharmacy. Intrauterine device, or IUD users, will usually know when their last period was. If the last menstrual period, or LEMP, is before age 50, leave IUD in for 2 years from LEMP and then remove. If the LEMP is after age 50, leave IUD in for 1 year from LEMP and then remove. For intrauterine system, or IUS users, it may not be clear when these women have reached the menopause, as many will have amenorrhea due to the IUS. Contraception is not needed after age 55, and most, but not all women will be menopausal by that age. Ideally, remove the IUS when women are over 55, but can be left a little longer if concerned they may not yet be menopausal, as no one will be pleased to restart their periods. In the case of IUS progesterone component of HRT, only Mirena is currently licensed for this purpose. The Mirena must be replaced after 5 years, as per COSRH advice, and the product license is for replacement after 4 years. If the woman is removing her IUD because her partner has had a vasectomy, just check that the follow-up specimen has been done and that he has been given the all clear. This is usually done 3 or 4 months after the operation. If the woman has an IUS, she may be getting non-contraceptive benefits such as amenorrhea or much lighter periods. She may want to consider leaving the IUS in a little longer to continue these benefits. In the case of removing an IUC for the purpose of switching contraceptive method, any pelvic pain and abnormal bleeding need investigation by an experienced healthcare provider before removal. If an IUS has been fitted as a gynecological treatment, the woman should discuss her concerns with an experienced HCP before removal. Ideally, the woman should have discussed which contraceptive method she is going to switch to and have started the new method at least a week before the IUC is removed so that there is continuous protection against pregnancy. If planning to switch from an IUD to an IUS or vice versa, then this can all be done at the fitting appointment. Remember, if a woman has had sex without using a condom in the 7 days before IUC removal, she could conceive immediately after the IUC is removed because there will be viable sperm in her genital tract. Always advise women at risk of pregnancy who do not want to conceive immediately to abstain from sex or use condoms for the 7 days prior to removal of IUC. For more of the latest guidance, training and qualifications in sexual and reproductive healthcare, visit cosrh.org. Thank you for watching.